All right. We are live on Instagram, so I'm just gonna wait a bit for people to join, and then we're gonna start for a second. All right. Welcome everyone to our Ask WHO live session exclusively here on Instagram today at WHO. Hi, Karen. So I'll get back to you in just a second. Well, I'm just gonna say hi to the viewers. How everyone's doing. Just drop in a comment. Let us know where you're watching from. It's always fun to see, which countries you're tuning in from. And as some of you might already seen from our broadcast channel this morning, if you haven't subscribed yet, I highly recommend it so you don't miss any updates or any live events like this one from WHO. So today's live Q&A is to mark World Contraception Day. By the way, I'm Yanwit. I work in the communication department here at the WHO headquarters in Geneva. Today, I'll be joined by a very special guest today. She is here already. So, hi, Karen. We are thrilled to have you with us today. And perhaps you could tell us about yourself a little bit, say hi to followers.
Yeah. Absolutely. So my name is Dr. Karen Tang. I'm a gynecologist in the United States. I am outside of Philadelphia, and I just was operating this morning, and I was like, I got to do my live with the WHO. So they found me an operating room that wasn't being used. So it's a real healthcare, setting, and so I do a lot of social media educating. So at Karen Tangmd, and I have a book called It's Not Hysteria that goes over all the topics in gynecology, including a huge chapter on birth control. And obviously, I think it's so important. And thank you to all of you from all across the world who are joining us today for World Contraception Day.
Thank you, Karen. So glad you could join us despite your busy schedule. Thank you for making the time.
Of course.
All right, so since
you make the time for the WHO.
Thank you so much. We're so
I'll clear my
honored.
schedule. Yeah.
All right, so today is World Contraception Day, as I mentioned, and over the next 30 minutes, we'll be diving into topics around access to contraceptives and making informed choices. And Dr. Tang will also share some, valuable facts and tips about, the different contraceptive methods out there. Before we get into the questions, I just want to kick off our conversation by just highlighting a key stat that I read this morning, actually, when I prepared the social media post for the day. Recent estimate shows that a lot of people, especially women, 257 million women of reproductive age around the world have an unmet need for contraception. So, Dr. Tang, why is it so important for people to have, access to a variety of contraceptive options?
Yeah, so contraception and sexual health is healthcare. So it's so important because, almost everyone, adults, will be sexually active at some point. And obviously, if you have a partner who can impregnate you, obviously that can lead to unwanted pregnancies. Being able to plan your family to prevent pregnancies when you're not ready for them allows women or people who are assigned female at birth to be able to focus on school, education, work, to be able to, both establish themselves in their career and also take care of their families. So if you have children, being able to kind of space the timing between the children also allows you to delegate more of your time and your care and your resources to the children you have. So, wherever you are around the world, it's incredibly important, and it's actually, named, I think, in UN development goals, because access to contraception and family planning is key to economic development, to communities, to entire economies. Being able to plan your pregnancies and to meet your life goals in addition to your family goals. So.
Thank you. Yes, and I totally agree. At WHO, everyone deserves access to safe and effective methods of contraception, so they can prevent, unintended pregnancies and protect their health in general. So speaking of options, I think some of our viewers might be wondering now how many types of contraceptive methods are available out there. Can you just list some of the most common,
So there's a whole range. So there are hormonal birth control methods, non-hormonal birth control methods, barrier contraceptives, which also can potentially protect against some sexually transmitted infections. So in terms of hormonal methods, like those are your birth control pill, the vaginal ring, the patch, the depot shot, the injection, the intrauterine device or IUDs, or also called the coils in certain countries, and then the contraceptive implant that goes under the skin of the arm. So those work by stopping you from ovulating or releasing eggs. They also have a couple of other potential benefits in that they oftentimes will lighten or take away your periods. So we do sometimes use those as treatments for people who have other issues like painful or heavy periods. If you have, heavy periods or painful periods from like fibroids or endometriosis, it's part of the symptom management. And then, so those are sort of the benefits. And they also decrease risk of ovarian and uterine cancer, so sort of a bonus. And then you have the non-hormonal methods. There are things like there's a copper IUD, intrauterine device that doesn't have hormone in it. There's also things like spermicide creams or foams and that sort of thing. And then not as popular in the United States anymore, so once we kind of get into the barrier methods, so condoms, both male and female condoms, prevent STIs, and they're also easily available like in, like stores and stuff. You don't need to see a doctor to get that sort of a contraception. And then, like I said, less common in the United States, things like the diaphragm, cervical cap, because they're a little bit less effective and you have to get them fitted. So I know in other countries they may be more common, but U.S. we sort of don't use those quite as much anymore. And then there are things like natural family planning where you sort of work with your own cycles. So you understand kind of, when you're ovulating or when your fertile window will be and try to avoid intercourse or use condoms or something during the fertile window. Those are good for people who want to avoid hormones, but they are a little bit harder to do. So sometimes, especially if your cycles are a little bit more irregular and are harder to predict, it may be harder to kind of know, and you also can do things like monitor temperature, cervical mucus, so it's a little bit more work. But for people who either don't have access to everything else or if they want to completely avoid, medications or devices and want to kind of work with their own system, like that's who that's for. But that generally are a little bit more tricky to use. Sorry. You're live with the WHO.
I'm loving this. It's so real.
That's all right. Sorry about that. But that was actually the end of my answer anyway. So yeah.
Okay. So there is indeed quite a few options that you just listed for us.
Yeah.
And as you mentioned, some methods are more effective than others in, preventing pregnancy, with condoms being the only, method that also prevents sexually transmitted infections, right? So before I get back to you, I'm just gonna, address to the viewers a little bit. We have got a good number of our viewers watching us now. I think it's around 1,000 people watching us. So that's a great number. So if you just join us, welcome. We're talking about contraception as today is World Contraception Day. Feel free to hit the Q&A button down below and send us your questions, and we're gonna, get to your questions as soon as possible. So back to you, what we were seeing, Dr. Tang. How do you, as a healthcare professional, help people choose, the appropriate type of contraception to use? Like, basically, how do we know which option is right for us?
Yeah, and that's a great question because there's not like one size fits all. Like there's not one perfect method for everyone. The reason there are lots of methods is because, there are different people have different preferences, like they have different access. I forgot to mention also the permanent sterilization. So, a tubal sterilization, vasectomy for people who are completely done having children. That's actually one of the more common contraceptive methods worldwide. So in general, the things that we mention to patients when we're helping them choose a method, number one is we talk about how you use it. So pills, you take one every day. The NuvaRing, you insert a vaginal ring once a month. The injections every 3 months. The IUD, you can place for up to 10 years. So number one, how long do they want to contracept for? So it's different if you know you want to try and get pregnant, next month, as opposed to I know I never want to get pregnant, or it's going to be like 6 years. So, how long are you looking to contracept for? Number two, what do you think that you can manage? So if someone, say, their job is very, the hours are very crazy, and, they may be working nights, days, like they may not feel comfortable taking a pill every day because they might forget a pill, or they just know that they're not going to be able to remember that. Somebody may not want to do a device because they don't feel comfortable with having a foreign body or something placed in their body. Some people want to, avoid hormones because maybe they tried it in the past and it gave them some mood side effects. So it's sort of just, picking kind of a thing that is convenient, it's feasible for them, that they can keep it up, that they will have access to it. Depending on where you are in the world, you may not have access to all of these methods locally, within your healthcare system. So, obviously it depends on, what options are available close to you. And then kind of keeping it up. So this goes into factors like cost, access, if you're a teenager, will it be difficult for you to see a doctor, get a prescription, that sort of thing. And then we mentioned earlier, are you treating something else? So if you have kind of heavy and crampy periods, a hormonal method may actually help with that too. So in addition to preventing pregnancy, you get the benefit of making your periods less uncomfortable. So all of those different methods, all of those different factors, go into that decision. And again, reversibility. So say someone knows they're completely done with having kids. All of the methods that we talked about have a failure risk. So these permanent methods have a lower failure risk. So nothing zero, but they're as close to zero as you can get.
So that's a great explanation. I mean, there's a lot of factors you said, a lot of questions to ask. I remember last week we ran a campaign on patient safety, and WHO really encourages people to ask questions and raise concerns, when visiting their healthcare provider. So building on this, your incredible answer, what are some of the key questions people should ask when they're seeking, advice on contraception from a healthcare provider?
Yeah. So, and this also goes to a lot of the questions that people have that I see on social media, or they come to see me, they may have heard something about a method and are scared about, are there some risks to this? What can I feel when I'm using it? For things like the IUD, will it be painful to have it inserted? So these are all really great questions to think through when you're thinking to yourself, what method is right for me? So your doctor, your healthcare provider, nurse practitioner, whoever you're seeing, should go over all of this already, but if they're not, they're important questions to ask. So, what might I feel? What are the potential, side effects? Will it affect my mood? Will it cause, irregular bleeding? Will it take some time to get used to? So those are important things. And then also the effectiveness is very important. So say someone, is I'm in school, I'm young, I really cannot take any chance that I get pregnant, I'm worried I won't remember to take a pill, obviously then that makes the failure risk higher. They may want to choose a method like an IUD, the implant or the shot, because they have a much, much lower failure risk. So, how effective is it? What might I feel when I'm using it, when a device is being inserted? How quickly will it reverse if I want to get pregnant? Things like the depot shot takes a very long time to reverse. It can take a couple of months. As opposed to the pill, you stop taking it and the next day you can get pregnant. So, the reversibility is an important question. And then people may want to ask about things like cost, access, for countries where there's insurance coverage issues like the United States, is there a difference in the cost of it? So those are all different things to ask about.
So, that's super helpful. There's a list of questions, and these are valid questions to get the correct diagnosis and the correct the appropriate treatment. But I hope our viewers are taking notes as well, right?
Yeah.
These question is super helpful in whether or not they're visiting a healthcare provider in the near future. But you can always come back and rewatch these slides as well.
I was going to say, this video will, I think, live on the WHO Instagram page. Yep.
Yes, sure. So they can come back and watch it. And I saw just one question, and I think it's pretty interesting. We talked about a bunch of, options that are available out there. So one question that I can just like scroll through the comments. Somebody asked, I couldn't remember the name. I'm sorry. So he or she's asking, what is the safest option?
So it depends on what you mean by safest. So if you mean like the lowest kind of side effect potential, like the least possibility that you'll feel anything different, then that's sort of your natural family planning, because you're just basically working with your own cycle. You're not doing anything to, take a medication or use a device or a procedure. But the flip side of that is the failure and the pregnancy risk may be a little on the higher side, especially if you aren't able to keep up with checking your temperatures and, abstaining during a certain window of your fertility. So if you're thinking in terms of safest as the potential for pregnancy, then the most effective, least risk of pregnancy include things like the sterilization procedures and the devices. So the intrauterine device, the Nexplanon implant, because there's less potential for forgetting a dose, like you're not going to, forget anything, and therefore it, has the least risk of failing. So if you're looking at like pregnancy risk, those methods are the most effective, the least risk of pregnancy. And then, if you are thinking about I'm trying to think of what are the other factors. That's pretty good. So like the side effect potential, the pregnancy risk potential, like those are, And then, like I said, the other ones, it's a matter of picking what's right for you. Yeah. So if you are young, you're healthy, you have very low risk of blood clots, then the hormonal birth control, the risk is actually quite low. So it's like only a few in many thousands will have any sort of like a major complication. So, like we're all putting it in context, like even if there's something as little bit more of a risk profile, it's not usually a high risk for most people. And I also mentioned, very important whenever you're thinking about methods, to not just compare the risk of just that method, you have to compare it to the risk of pregnancy. Yeah. Because this happens a lot on social media where people will be like, oh, don't take hormonal birth control, it's dangerous, it's going to make you, have mood symptoms or whatever. Everything that is a potential side effect of hormonal birth control in pregnancy is much worse. So mood changes, blood clot risk, weight gain, like risk of death, like there's maternal mortality. So whenever you balance the risks and benefits of something, you're not just looking at just that method. You compare it to the alternatives, the other types of methods, and you compare it to the risk of pregnancy. Because if you avoid all the methods and you get pregnant, then your body's already at a lot of risk because the hormones in pregnancy go way up. So very important to do that, because sometimes people on social media will try and scare you. They'll be like, no one should ever be on hormonal birth control. It's too dangerous. That's a very, very misleading approach. So,
I mean, that's a great explanation, and then you already mentioned it because this is up next with my question actually.
Look at that, yeah.
Because like there is some myths around contraception, and including the one thing that I often see is concern or misconception about hormonal contraceptives, like especially regarding their side effects that you just mentioned. Yeah. Perhaps you can we just like talk a little bit on this specific type of contraception? Like, could you explain like to our viewer who just joined us perhaps like what hormonal methods are and what people should know about their pros and cons?
And cons, yes, exactly. So the hormonal birth control methods, they all have some sort of progesterone hormone. Some of them have estrogen hormone as well, and those include most birth control pills, the NuvaRing, the vaginal ring, and then the contraceptive patch. Those have estrogen. Estrogen is what has the risk of when you hear about blood clots and strokes and things like that, that's the estrogen is part of that risk. Again, that risk is very low. In most methods, it's like only a few and several thousand users will have a risk of a blood clot. But all of the hormonal methods kind of have a potential risk of things like mood symptoms, like that's the main, common one, like maybe like breast tenderness, like that sort of thing. But like I said, the benefit is that they can almost all like lighten bleeding, cramping, like period stuff. If you have, say, worse symptoms around your period of like PMDD, premenstrual dysphoric disorder, really, really bad mood symptoms with your period, it evens out your hormones, so we use it as a treatment for PMDD, PCOS, polycystic ovarian syndrome, where people have irregular periods, missing periods, and then also things like period migraines. Like sometimes people have like other health issues that get worse with their periods, like they get really bad headaches or migraines. We also use it for that as well because it kind of evens out your hormones. So in general, when we're assessing for someone's choice of contraception, we'll ask about risk factors for blood clots and strokes. So do you have high blood pressure? Are you a smoker? Do you have a family history of blood clots? Like, do you have migraines with auras where you see like starbursts or like wavy lines, because that's a higher risk of stroke. So we will always assess your health to see if you are at higher risk, and then we might avoid the estrogen-containing birth controls. And so.
Well, thank you very much for clearing that up. I think a lot of people watching us will find this really.
That's probably the biggest, the biggest question or misconception is always around hormonal birth control.
Like in understanding like the actual effects of these hormonal contraceptives. And I'm seeing like one or two. Like I got a couple of questions on IUD. Let me just pull it up. So, how does the IUD work, and do IUDs hurt? Is there a surgical procedure related to these? Can you give us some, brief explanation?
Yeah. So, in general, the IUDs mostly work by affecting the sperm. So what's interesting is that if you look at IUDs around the world, they all look totally different. And so in a lot of places they have a T, they're usually T-shaped, and the way that they're inserted is the little arms are folded up, and they're very skinny, like they're folded up inside a super skinny straw that we put through the vagina, the cervix, and into the uterus, and then we pull the straw back and leave a little T in there with a little string hanging out so we can pull it out and remove it. But in other countries, like I've seen, so in China for a while when it was one-child policy, they were placed as permanent birth control. They put like a ring in there, like a little metal ring, and leave it in there forever. It was not meant to be removed. So I've removed quite a few of them, like you find this little metal ring that there's no way normally to get it out, but you can get it out. And then in other parts of the world, I've seen ones that are just like almost like kind of like a plastic string that's like wrapped in a little like kind of like a little halo. Other ones are like a little kind of like a curve, like a little like like a little spiral looking thing. So they're all different shapes. So it's interesting, all different shapes, all different materials, but they all seem to work by disrupting the sperm function. There are progesterone IUDs that have progesterone hormone in them that also work by thickening the cervical mucus and preventing the sperm from getting through. So there's actually, interestingly, I've made videos on this. They actually did studies where in people who were getting like a tubal, like they were getting sterilization anyway, they checked the tubes of people who both had IUDs and didn't. And the people who didn't have an IUD, they found like live sperm. They found like fertilized eggs even. And then if you had the IUD, they found like dead sperm. They had no fertilized eggs. So interesting, it does seem to work on the fertilization end of things. There's a question about whether they prevent implantation. We don't know. Like there's no way to have a microscope in there and tell if there were fertilized. But again, like the studies that I've seen, there were no fertilized eggs that were found. And so it seems to mostly work by the sperm mobility. And they can be uncomfortable going in. That's been a lot of discussion recently. So if you have had a baby vaginally, like say you just gave birth and they're putting an IUD in basically right postpartum or a couple of weeks after having a baby, most women feel almost nothing because the cervix is already open. It's easy to get it in. If you've never had a baby before, it can be more painful. But it's very individual. Some people feel pain, some people feel just cramps, some people feel nothing. So there's a lot of talk about pain control methods with IUD insertion. So there's a lot of us now who are trying different creative things. Numbing shots can be kind of painful themselves. So in the past, we didn't used to like give numbing medicine to everybody because the shot almost hurt as much as the IUD. But now, like, we're doing things like we try and put, like, numbing medicine into the cervix, like, through a straw, like, or a gel or something, so you're not using a needle. And also using things like nitrous oxide, like laughing gas, like a dentist would use to make you kind of sleepy feeling. So there's a lot of things that people are trying to do. And obviously, access is different across the world. But it is something to discuss with your doctor about what they can offer to make it less uncomfortable for placement.
Thank you. Insightful. I hope that answered you guys' questions about IUDs. And aside from, contraceptive options that we just talked about, hormonal contraceptives, IUDs, or any other types, I just wanted to know, like, are there any other common concerns you hear from your patients, like, in your practice about contraception?
Yeah.
And how do you usually like address them, response to?
Yeah, we kind of address the two big categories where like hormonal contraception and like side effects like mood and like other things that they might feel, and then IUDs and pain. So those are the two big categories. I will say also with hormonal methods, like people hear a lot of things about cancer. So they're like, oh, it's going to cause cancer. All of the birth control methods, interestingly, including IUDs for whatever reason, have a teeny increased risk of breast cancer. That is very, very small. So again, pregnancy increases risk of breast cancer, but we wouldn't tell people never get pregnant. You know what I mean? Like, so you have to kind of put it in context. But the risk is overall incredibly low, especially if you don't have a strong family risk of having breast cancer. And then obviously there's a lot of health risks of unwanted pregnancies. Pregnancy itself is a lot of risk to your body. So again, we have to balance that. But overall, and people are always amazed at this, the overall risk of cancer is lower if you take hormonal birth control because it decreases your risk of ovary cancer and uterine cancer. So it's protecting you against uterine and ovarian cancer. So overall, when you take hormonal birth control, your actual risk of cancer is lower. So we actually do give birth control to people who have a higher family risk of ovarian cancer, uterine cancer to protect them. So like I said, the myth is, oh, birth control is going to cause cancer and, that's really dangerous. The reality is it actually lowers your risk of cancers overall and has a teeny, very small, like way less than 1% increased risk of breast cancer, which, again, knock on wood, I've never in my whole, 15 years of being a gynecologist had a patient who got breast cancer from hormonal birth control, so it's very rare.
All right. Awesome. Just wanted to reiterate, if you have concerns or anything, just, seek medical advice, to seek advice from, healthcare provider, rather than just, reading on some forums. Or,
TikTok, Oh, I almost forgot. Another myth is that it's going to make you infertile. I don't know where this myth, it's a myth that you said it's going to make you infertile. Where I think the myth came from, because obviously it's false, it's not true at all. Most birth control, as soon as you stop it, your fertility is back. That's why if you miss one pill of birth control, you can get pregnant the next day. It's like out of your body so quickly. Where the myth came from is basically because of age. When you are older, your fertility is lower because for women, your egg pool goes down, the egg quality degrades over time. So it's harder to get pregnant when you're 40 than it is when you're 20. Yeah. So if someone were on birth control from age 20 to age 40, they may have trouble getting pregnant just because they're older. It's not because the birth control did something to them. But then you'll hear this myth, oh, so-and-so took birth control for 10 years and then she couldn't get pregnant. It wasn't that the birth control made your fertility worse. It's just because you waited, time passed. And your fertility, it's harder to get pregnant the older you are. So the longer you're on something, it's just the effect of age. So you'll see this from all the fertility doctors will tell you that there's no impact on fertility. So
all right.
That's a huge myth. It's very important to debunk. Yeah.
There's a lot of myths around this,
A lot of myths, yeah.
A lot, but we cannot address them all in one Instagram live.
We did a lot of the main ones, so that's good. We did a good job.
That's good. So we talked a lot about, hormonal contraceptives, but what about men?
Yes.
Are there enough options for men?
Yeah, so
right now?
Important to know, for men, this is something that's not just a woman's responsibility. Obviously, the male partner should be part of this discussion as well. So if you are going to be sexually active, have the discussion with your partner. Consent, contraception, STI prevention is all part of having a healthy sexual life and sexual relationship. So, having a conversation with your partner. Unfortunately, for men, there's basically the male condom and vasectomy that they are responsible for, so to speak. But there are some research into a male contraceptive pill. Nothing is available that I know yet. But it's something I know that they're researching. But like I said, very important that, like any men out there, that this is part of your responsibility too. If someone gets pregnant, it's not just the pregnant person, it's also, you're involved as well. So having a conversation, talking with your partner before you're having sex about what you're going to do to prevent pregnancy, et cetera, very important. So the discussion is almost as important as the actual choice of the method.
Yeah. Thank you. I think, there's it's a two-way responsibility, male and female, right? Men and women.
Oh, I almost forgot withdrawal, because I don't consider that a real method. But the withdrawal or the pull-out method, like some people will use, it's basically almost the same as doing nothing. The reason is that before you ejaculate or come, like there is a fluid that can come out of the penis called pre-ejaculate or pre-cum that has sperm in it. So even if you haven't ejaculated, you can still get someone pregnant with that fluid before you realize it. And then also it's very hard to withdraw exactly at the right time. Like sometimes some semen may come out. So, in general, it's something like only like 80% effective, meaning that 1 in 5 couples who uses withdrawal is going to get pregnant within the year. So that's a high rate. So in general, if you're using another method too, like if you're using like birth control and withdrawal, like as a second method. It's good as a second method. It's not good as your primary method.
Okay.
So, yeah.
That's clear. I have this last questions, actually. These questions is interesting. I think I saw this question, like, floating around. Like, if someone missed 3 pills, like birth control pills in a row, they can just take 3 in a day to prevent pregnancy. Is that correct?
So, yeah, like at that point, we almost just assume it's not going to be effective that month because you could, during those days, have ovulated. If you forget 1 pill, the next day you take 2. So like if you forget it one day, you're like, shoot, I forgot. The next day you double up, you take 2 at the same time, and then you go back. And in general, most of us will say, like, use condoms, use a backup method, just in case, because you do, the more pills you forget, the more likely you're going to get pregnant. And then the package inserts actually include instructions on what to do in case you forget. So if you have a birth control package, keep the insert in there because it includes what to do, if you forget 1 pill, 2 pills, whatever. Usually more than 1 pill that you forget, just assume it's not going to work. Keep taking it. So keep taking the pills once you remember, but just use condoms and just assume that month is not effective. And so, like I said, keep on going just so you remember the pills, but just use another method like condoms just in case.
Okay.
And then we also didn't mention emergency contraception. So say someone, like forgot like many pills, or they had a condom that broke, or they just had unprotected sex. You can do emergency birth control, which is basically a hormonal birth control pill or 2 that you take to try and keep you from ovulating. And that in a lot of countries is available over the counter in some way, like you don't need a prescription from a doctor. Some of them you do. So it's important to look up in your country what access there is to emergency birth control. It's also called like Plan B. Some of them require prescription, some don't. You can also actually insert a copper IUD as emergency birth control. That's actually the most effective one. A lot of people don't realize that. So if you need ongoing birth control, you need emergency birth control, if you can find a place that can place a copper IUD quickly, like that's actually the most effective one. But very important to also know that that's not the abortion pill. There's a lot of misinformation that emergency contraception or Plan B is causing abortions. It's not. It works by, like any other birth control pill, it keeps you from ovulating. If you've already ovulated, it's not going to do anything. So in the U.S. especially, there's a lot of confusion about that. People call Plan B the abortion pill, but they're not the same thing.
Thank you.
Yep. I believe I forgot that category. Like that's a big category. Yeah.
I mean, I think we have mentioned a lot of options, and I just wanted to reiterate this to our viewers that there are options. You just need to talk to your healthcare provider to find the right one for you.
Yep.
And as much as
one of my patients just commented, I'm like, hey, that's what I'm saying.
Let me just look at the questions one more time if there's any interesting ones that we can. But as much as I love to keep this going with you, we're running out of time.
We fit a lot into 30 minutes. This is great.
And there's a lot of information. I would suggest our viewers to come back and rewatch the live because within 30 minutes we talked a lot about everything.
Everything.
Not everything, but a lot of things that we covered today. So. Do you have any final thoughts for our viewers, Dr. Tang?
Yeah, so it's just important, like we led off with, everyone deserves birth control, and they deserve birth control that works for them. So you deserve to kind of hear about a range of different options and, like, the risks, the benefits, the pluses, minuses, so you can find the right fit for you. So, make sure you ask all your questions, you ask your doctor, and, get that good fit. And sometimes if you choose one method and you're, like, not super happy with it, go right back and choose a different one. Sometimes people will, like, tolerate one method. They're like, I don't love this. It's kind of, I'm having lots of bleeding or I'm having lots of mood symptoms, but I guess this is what I'm stuck with. Try and get, a second, not second opinion, but another option, talk about what the alternatives are, et cetera. And then, find the right fit for you. Because obviously preventing unwanted pregnancies is so important. There's many health benefits and benefits in terms of your life. So, and then I was mentioning, so I have a book called It's Not Hysteria, and it's available pretty much worldwide. I've seen it in the Philippines. I've seen it in different countries. So in the U.S., it has a rainbow cover, and in the U.K. and the Commonwealth, it has a lightning bolt on the cover. But if you look up my name, Karen Tang, and It's Not Hysteria, the book, you can usually find it to ship somewhere, wherever you are in the world. And so it has chapters on everything, including a big, big chapter on birth control. It goes over all the methods, the risks, the benefits, how it's done, things to think about, all the things that we mentioned already. And so if you're look, I'd love to learn more, as people are asking me, cervical cap, depot shot, you can learn more about each of those methods in the book. And so.
Thank you so much. Thank you very much, Dr. Tang, for this, incredible conversation that we just had. And thanks to everyone as well for joining us today. If you want to learn more about contraception and, sexual health in general, make sure to follow us here on Instagram at WHO. And don't forget to check out Dr. Karen Tang account, Karen Tangmd.
Yes.
Is that correct?
Yep.
Okay.
Yeah, that's perfect. Thank you again for having me, and to everyone all over the world who tuned in. This is so exciting. And talk to your friends. Very important, kind of a final message. People sometimes keep sexual health stuff very quiet and private, they feel oh, it's too embarrassing or it's shameful. This is something that almost everyone's going to have to deal with. It's not something that only you are going through. So, talk with your friends. If they're confused, point them to the WHO, to, my page so they can get information, point them to their doctor. Encourage your peers, the people in your community, your friends to get care if they need to. And just opening these conversations is so important. That's actually, the first step to being able to get good care and answer your questions. So
that's
perfect.
That's a great advice to end on. And thank you again for joining us.
Thank you.
And
Thank you,
see you next time.
All right, see you next time.
Bye-bye.